Good day. I am Dr. Hannah Urbanozo Corpuz, and it's a privilege for me to be speaking to you today. My clinical practice is as an adult endocrinologist. So, endocrinologists are doctors who have typically taken up 3 years of internal medicine residency training and then an additional 2 years of subspecialty training in endocrinology. So, what we handle are hormone and metabolic problems such as diabetes, thyroid disorders, overweight and obesity, osteoporosis, menopause, and the like. Now, my mother organization is the Philippine Society of Endocrinology, Diabetes, and Metabolism. And many of my slides are from our website, which I will refer you to at the end of the lecture so that you can access more educational materials for the diseases listed here. But what we will talk about today is diabetes in the context of the current pandemic. So we know that following the spread of COVID-19, as of March last year, WHO declared a global pandemic. And as a result, social containment measures have been adopted worldwide. And healthcare systems have been reorganized, some really drastically, to cope with a number of acutely ill patients. And at the time of recording of this lecture, the Philippine tally is already at 1.3 million with about more than 24,000 deaths. Now, among those who had severe COVID-19 and those who died of COVID-19, it was found that there's a high prevalence of concomitant conditions, and this includes diabetes. So this is why we are investing our time in this particular topic. The outline for our discussion we'll be covering the basic pathophysiologic mechanisms of diabetes. So what goes wrong in the body of an individual with diabetes. And then the risk of severe COVID among diabetics. We look into the evidence for that. And what are practical tips that we can share with our diabetic patients or with regards to how they will manage COVID, how they will manage diabetes rather in this time of pandemic. So let's go first with the basics of diabetes. So diabetes is a group of diseases. There are different types of diabetes. You have type 1, type 2, and then the more rare ones would be your latent autoimmune, diabetes of the adult, maturity onset diabetes of the young, and then you have the kind that happens when one is pregnant, or what we call gestational diabetes. Okay, so basically, it's a problem with the way the body handles carbohydrates. Okay, so but before we understand the disease, first we have to understand how a healthy individual processes carbohydrates. So this is a simplified version of that process. You have a healthy individual here who ingests carbohydrates. Examples would be your bread, your rice, your pasta. It gets digested by the stomach and it goes to the intestine where it is then turned into glucose. Glucose is the basic substrate that is needed by our cells for them to function properly. So glucose, which comes from carbohydrates, is the main fuel of our cells. So it provides energy for the cells of our body, without which they will not be able to function. Okay. So as that healthy, so let's go back to that healthy individual who had just eaten her carbs. Okay. So as that healthy individual produces glucose from the carbs that she ate, signals coming from her intestine, hormonal signals, will be going to the pancreas, telling it that it is time to release insulin. So the insulin comes from the beta cells of the pancreas. Okay, so in this way, the production of glucose and the release of insulin from the pancreas is actually synchronized. So this is where you'll really wonder at the work of the Lord, no? So that how complicated and yet how coordinated He has designed our body. And so here we have glucose, we have insulin, and now the muscle or the muscle tissue, the tissues of our body, will really need insulin for them to be able to take in glucose. So a simple analogy for that would be that your insulin is the key. The keyholes are in the muscle, and you need the key to open the door so that the glucose will be able to go into the tissue where it is supposed to go. And so the muscle is going to be able to function properly. Okay, so this is how a healthy individual basically processes carbohydrates. Now, what happens among your diabetic individuals? So let's look at the two more common types of diabetes. First would be the type 1 diabetics. No? So for type 1 diabetics, when they eat their carbohydrates, their stomach will be able to, again, digest the carbs and produce glucose. However, the main problem with them is that their pancreatic beta cells are unable to produce insulin. Now, why is that? Now, the more accepted or the most accepted reason is there is an autoimmune process. So the immune system of these patients attacked the beta cells, and then this resulted in lack of, or actually virtually no insulin for these patients. So without insulin, you don't have the key to open up the doors in the tissue, and so your glucose is unable to get inside the tissues. Okay, so what happens? The glucose stays in the bloodstream, right? So that is your typical uh, pathophysiologic mechanism for type 1 diabetics. Okay, so type 1 diabetics are typically young of age. They can be pediatric even. No? So they are actually, most of them are at pediatric age when they are diagnosed. And because they do not have insulin at all, it is essential that they are put on insulin as their medication. Okay. Now, contrast that with type 2 diabetics. Type 2 diabetics typically are older individuals. They are more on the heavier side. No? They occur after 40 years old usually. No? But there are also type 2 diabetics among younger individuals. But that's not the common presentation of type 2 diabetes. For every one case of type 1 diabetes, it is said that there are 18 to 20 individuals with type 2 diabetes. So by and large, the more common type is your type 2. So what happens as they eat their carbs, they produce or they digest their carbs, and there's a production of glucose. Their pancreas does have insulin. However, unfortunately, they have what we call insulin resistance. So the muscle is not amenable to insulin working on it. So as another analogy, we can think of it like the keyholes are rusted. The keys are there, but they are unable to open the door. And so again, the glucose is not able to get in where it's supposed to go. So in both cases, even if they have different mechanisms or different dysfunctions, in both cases, the glucose gets stuck in the bloodstream or in the circulation. So it is said that diabetes is a case of starvation in the face of abundance. There's abundant glucose going around. It's just that the body cannot use it properly. So, and with this, if you leave the glucose circulating for a long, long period of time, that is when you get your different complications, okay, that we are familiar with in diabetes. Now, back to diabetes in the time of COVID. So, we've said that people with diabetes tend to get more severe infections. So, is it true? So, that is phrased as a question here. Is it true that persons with diabetes who contract COVID-19 infection develop more serious complications? And the answer is yes. The evidence to that include the following, no? But not limited to the following. So these are studies, early studies done in China, and where they found that the overall death rate among all patients who contracted COVID was about 2.3%. So let's say 100 individuals got COVID, and that would be mean about 2 deaths. And then the case fatality rate, however, for individuals who are diabetic, that would be about 7.3%. So if you just take COVID patients who have diabetes, the death rate actually increases 3 times more than the overall death rate. So that's quite significant. So it's something that really grabbed the attention of healthcare providers. Another study found that uh, 27% of patients who required mechanical ventilation or ICU care or died actually had diabetes. So a quarter of the patients who had bad cases of COVID were actually diabetic. Okay. Now, this is especially true if the person with diabetes has an older age, more than 60 years old, if they have uncontrolled blood sugar, if they have complications of diabetes already. So, complications like kidney failure, stroke, heart attack, or if they have hypertension or heart disease. So, the combination of these factors really make a particular diabetic more susceptible to severe infections. So, what is the one factor here that we can do something about while we are at home? Now, of course, hypertension we can do something about by being diligent with our lifestyle modification and with adherence to medications and recommendations of your physician. Since we're talking about controlling blood sugars, let's look into what uncontrolled blood sugar is for diabetics. So what does evidence tell us again? So there's another more recent study. This was done just last December. And they found that among patients who were admitted to the intensive care unit who had poor blood sugar control at the outset, were 3 times more likely to die than patients who had better blood sugars upon admission. So if you're a diabetic and you know your blood sugar is well controlled and you get COVID, the chances of you getting really badly sick are lower than if your blood sugar was bad to begin with. Okay? So remember, the risk of contracting COVID-19 infection is the same for both persons with diabetes and without diabetes. However, once a person with diabetes contracts COVID-19 infection, there is a higher chance of developing serious complications from the infection. Now, why might COVID-19 and other viruses be so risky for diabetics? Some of the reasons that are thought for this are: number one, the dysfunction of the immune response makes diabetics more susceptible to infections. It's thought that hyperglycemia or high blood sugar or uncontrolled blood sugar among diabetics cause dysfunction in the immune response. We'll look at this at the next slide. Okay, so this makes diabetics more susceptible to infections. Okay, so not just viruses, we know that they are susceptible to getting non-healing wounds and genital mycotic infections and the like, fungal infections, yan. And then second, there may also be damage to the circulatory system, okay, that slows healing. So some diabetics have a poor circulatory system, which slows the healing effects of the blood from getting to and from the areas where healing is needed. So we're familiar with delayed wound healing, particularly of the foot, no? So they get serious foot diseases if left unchecked. Okay. So just a graphical representation of how high blood sugar hinders the proper function of the immune system. So as an example, let me turn your attention to this area of the slide. So let's pretend this is the skin, and this is your site of breakage where there is infiltration of bacteria. So there's site of infection here. Bacteria would be yung pathogens. And here comes your neutrophil. So this is one of your soldier cells, right? And it has to go through these different processes for it to be able to meet the bacteria and to actually eat it, phagocytose it, and kill it, okay? So as we can see here, the process of chemotaxis, of adhering to the blood cell wall, of integration into the blood cell wall, they can all be hindered by hyperglycemia, right? So this is why it's important for us to address high blood sugar. So what then is controlled diabetes? So how do you define controlled diabetes? Generally, we use hemoglobin A1C and fasting blood sugar to determine control. So if your hemoglobin A1C or glycated blood sugar is or glycated hemoglobin rather, is 7% or less, and your fasting blood sugar is 7 millimole per liter or less, that is what constitutes controlled diabetes. However, these targets may be individualized according to your profile. So you'll have to ask your doctor about this, okay? Because there are other factors that are taken into consideration when giving you targets for blood sugar control. So again, the chances of having complications will be lowered if blood sugar targets are met. Okay. Now, what if, okay, so that's well and good. I know I'm a diabetic. What do I do now in this pandemic? Okay. So what is going on right now is that we are in and out of quarantine. So what if you find yourself in a lockdown again and you're a person with diabetes? So just think about these three things. No? Think, talk, and work for safety. Again, this is brought to you by the PSEDM. First, think for safety. Think of the things that you need to prepare for staying home for a long time. No? So keep in handy the phone numbers of clinics, pharmacies, and medical insurance. So there are a lot who deliver pharmacies that will deliver medications for you. What would be the list of medicines and vitamins that you need? Stock up on them, including insulin if you are prescribed insulin. And then also stock up on simple sugars in case you get hypoglycemia or low blood sugar. So that would be candies and regular soda. No? And then enough supply, of course, food and water and sanitizing items like alcohol. So think about those things. Then talk to your healthcare provider or doctor about the following. So how often to ask them, how often should I check my blood sugar? What medications do I need if I get the cold or flu or and the like? What changes do I need to make? Do I need to lessen this particular medication? Do I need to discontinue this medication if I get sick? And when should I call the clinic or actually go to the ER? Okay, so don't be shy to ask these things from your doctor. And then work for safety. Okay, so work on your preventive measures and avoid unnecessary exposure to COVID-19. Clean, sanitize your hands often, clean your house, disinfect surfaces, especially our cell phones. That's something that we forget to disinfect, and yet we carry that all the time, no? Sometimes even in the CR, okay? Then avoid touching your face, your nose, and eyes if you haven't washed your hands yet. Avoid handshaking. This one we're more or less used to these practices already. There's no more handshaking, no more beso-beso. Yeah. And touching surfaces like doorknobs, handrails, and elevator buttons, especially if you are in a public area. And avoid crowds and non-important travel. So I know cabin fever is a thing. It's for real, but if you can hold off on that travel plan for leisure, please do so. Please stay at home. However, if you really cannot stay at home, vaccination for COVID is encouraged. So vaccination for adult individuals with both type 1 and type 2 diabetes is generally safe with proper guidance. And individuals with diabetes have to consult their attending physicians to be guided accordingly because you might have other comorbid factors that need to be dealt with as well. Then specific storage requirements should be considered and proper care for vaccines is warranted to ensure their viability. So make sure that you're getting your vaccine through legally designated centers, right? So that you are assured of their quality. And then vaccination adverse effects are generally mild to moderate and often well tolerated among diabetics. So typically just the same as what the general population would experience. Now these guiding guidance statements are also from the PSEDM. They were released last March 8th, 2021. And do check the website, which I will share with you later on, for updates on these statements if ever new evidence comes to light, right? But for now, these are the vaccination guidance for our diabetics. Now, you might wonder, do I need to secure a medical clearance from my physician before I get vaccinated? Let me just share with you an infographic FAQ rolled out by the Department of Health, no, with Res Vacuna tagline. Okay, so here, FAQ number 6, who among group A3, no, group A3 is the group with comorbids, who among the group A3 will need medical clearance? So persons with any of the following comorbidities will need a physical or electronic medical clearance from their attending physician. So persons who have autoimmune disease like lupus, rheumatoid arthritis, persons who have human immunodeficiency virus or HIV, those with cancer or malignancy, patients who underwent transplant, no? Those who are undergoing steroid treatment. What are steroids? Prednisone, dexamethasone, yun, ganun. And then patients with poor prognosis or who are already bedridden. So we have a poor life expectancy already. So those persons with other comorbidities not mentioned above, such as diabetes, only diabetes, do not need a medical clearance before vaccination, but should show any proof of comorbidity and undergo screening on vaccination day. So still, talk to your doctor, about this, but it's not really absolutely necessary for you to secure medical clearance. All right. Now, on to the more practical tips for a diabetic. I think the more challenging aspect of diabetes management at the time of lockdown would be how to handle insulins. So here are some digestible information about insulin that will help you. Okay, first of all, it's important for you to know the generic name of your insulin. So there are two basic types of insulin, the human and the analog type. The human insulin includes the regular NPH isophane and the biphasic human insulin. So basically, just look at your vial or your pen and it will say they're human. Yan. So that's human insulin. The analog insulin are the new ones, okay, the more modern ones, and they have different names. The rapid ones are called blue lysine, lispro, and aspart. And then the more long-acting ones will be the degludec, detemir, and glargine. And then you have a mixture of the rapid and the longer-acting one. That's a biphasic insulin, lispro, and aspart. Okay, so for your human insulin, they typically, the typical onset of action is 1 hour. For the regular insulin, which acts more rapidly, it's 30 minutes. So which is why generally you will be instructed by your doctor to inject these types of insulins 30 minutes before a meal. 30 minutes before a meal. Okay? So why is it important for us to understand the timing and effect of insulin? It is because so that we will understand the best time or the timing of injection. Okay? So your regular or fast-acting insulin will peak in 2 to 4 hours and it will last from 6 to 8 hours. Whereas your isophane insulin may last to 12 hours. Okay, so both are, again, human insulins. For the pre-mixed insulin, mixture of fast-acting and long-acting, you have the biphasic human insulin, and then the analog insulins also have your mixed type, no? So these are your biphasics, okay? The only basic difference is for human insulins, the requirement is to inject 30 minutes before meals. But for analog insulins, the requirement is shortened. So you can inject them right before a meal even. So, but the typical recommendation is 5 to 15 minutes before a meal, right? So the same is true for your rapid-acting insulin analogs, 5 to 15 minutes before a meal. And then for your long-acting insulin, like your detemir, degludec, and the glargines, since they are peakless, so they do not have a peak effect, they're quite flat in their profile, they hardly cause any hypoglycemia, provided they are used correctly. Okay, so you can inject these long-acting insulins before or after eating. And so if provided that you inject them at the same time of the day, every day, no? So around the same time of the day. For example, if you inject it at 6 a.m. on a Monday, you have to inject it at around 6, 7. Yeah. So you have a 1 hour window that you can inject it around the same time so that you will get a steady state concentration for these particular insulins, no? Your long acting analogs. All right. So you may do a screenshot of this, or you can visit the website later on, but you can review this more. Okay. So now, how do we store insulin? We store used or opened insulin. You can store it at room temperature, less than 30 degrees, for 6 weeks if you're using a vial, 4 weeks if you're using a pen. Do not store in the freezers. Yung mga insulin naman that are not in use yet, not in use, you're not opened yet, just store them in the refrigerator at 2 to 8 degrees in a horizontal position. And then how do you dispose of your needles? Dispose of your needles in a plastic container, separate plastic container, so that you avoid needle prick accidents. And then you can bring this plastic container to your doctor, and your doctor can dispose of them for you. That's what I do for my patients. And then there are recommended blood sugar levels also for non-pregnant individuals. It's important that you are able to stick to these levels, right? So pre-meals, 80 to 130. 2 hours after a meal, at least less than 180. Now, if your blood sugar levels are always above target, despite proper diet and medication, you may need to adjust your insulin. Okay? So, as we have said, we need to monitor our blood sugars. So, an important adjunct to insulinization or to use of insulin is, of course, the use of your own blood sugar monitoring device at home, okay, or your glucometer. So, tip is to get a glucometer uh, that has readily available strips. Okay, so don't get a glucometer na walang strips. No? Mahirap hanapin yung strips. Right, so this is how we use the glucometer. Wash your hands, dry them well, insert the lancet or the pantusok into the lancing device, and then insert the test strip into the glucometer. Prick the end of one finger using your lancing device. You can squeeze it so that a little bit of the blood comes out, and then apply the blood to the test strip, and read and write down your blood sugar, right? Okay, and then you can present this record to your doctor so that your doctor will be guided also accordingly. How frequent should you monitor your blood sugar? So typically, you'll be asked to monitor 4 times a day at the following times. So before breakfast, before lunch, before dinner, and at bedtime, no, or before going to bed at night. However, the frequency may also vary among patients. So ask your doctor about this. We can be quite flexible to your needs. So we understand that the test strips can be quite costly also if you monitor 4 times a day. So we can work around what you have, provided that it is what is good for you, okay? What is best for you health-wise. Again, the blood sugar targets before meals is 80 to 130 milligrams per deciliter. If you have a glucose monitoring system that reports single-digit numbers, then the units that it's using is millimole per liter. That would be converted to about 4.4 to 7.2 millimole. So to convert, just divide the milligram per deciliter by 18. So 80 divided by 18 is 4.4. 130 divided by 18 is 7.2. So the same is the conversion for this. So after meals, again, the target is at least less than 180 or 10 millimole per liter, right? So targets may vary among patients. Again, always revert to what your doctor will tell you. Always ask your doctor, okay? So those slides are from the Philippine Society of Endocrinology, Diabetes, and Metabolism. We have a diabetes advocacy and study council that created these slides and made them available. And you can find them in this website. So you can take a screenshot so that you can visit this after the lecture or later on. Ano, you can visit this so that you can have access to more educational materials. And with that, again, I thank CCF, I thank Life to the Max Ministry, Miss Katz and Miss Chrisan, and Dr. Penserga for inviting me and for allowing me to share these things with you so that together we can help beat diabetes. So if you have any more burning questions, you can ask your healthcare provider, or you can drop an email at doctora.hana@gmail.com. Again, thank you very much and God bless you all.